I'm Dr. Samantha Hitchmus. I'm one of the doctors here at Wilson Family Practice.
And when did you join?
Oh, I've been here for 5 years. I've locumed here for 3 years, and then I've been permanent here for the last 2.5 years after taking over one of the retiring doctor's practices.
Nice. I'm Dr. Kendra Strong. I've been here for 5 years after locuming here several times, and we're going to tell you a bit about the Wilson Center Family Practice, which is a 15 doctor practice in downtown Port Coquitlam. Poco is a really big growing community, so that really helps. I also personally like that it's, I don't know if you disagree, but in between the city and like Maple Ridge, because what happens is we get a decent number of patients coming from like Maple Ridge, even as far as Mission, and those are a lot of people who can have a lot of pathologies, which is good sometimes. You don't want to just do simple medicine, so to speak, but then you also get people who will come in from the city. So I like that personally. And then just speaking about logically where you are, it's great. We have a new community center across the way. You could go work out there on your lunch break. There's a library over there. You can walk to restaurants and coffee shops. So it's nice to be in a nice walkable area as well. I think team-based care just provides a better experience for the patients overall. So here at Wilson, we have basically a 1-to-1 ratio of staff and physicians. We have 2 nurses who work here, so we're able to provide a full scope of care for our patients, which I think improves the experience.
Yeah, and I would say we have this great addition of having a public health nurse that's come to work with us, so she's been super helpful with things like vaccines and advice in terms of well baby checkups. Vaccination advice has been great from her, so that's been super helpful, as well as doing blood pressure checks for us. So it's really helped support the physicians here to take a little bit of the load off of us.
Several doctors do the long-term care initiative, and then Dr. Short does lumps and bumps for us. So she actually trained in Venezuela as a surgeon and then moved to Canada. So she does a lot of that work for us, which is great to be able to do it in-house. And then I think it's just me. I also do IUD insertions for the clinic. So I take referrals from everyone else in the clinic, and it keeps it pretty busy.
So we use Profile EMR, and so all of the scheduling is done through our EMR system. And so we have our front staff MOAs, and they book visits either through telephone or people walk in and book visits. We also have the option of online booking. Often doctors will book patients as well if they're wanting follow-ups. If we have the ability to do that as well, and so it's super easy to book appointments here.
Each physician sort of can have their preferences in terms of how long appointments are, or how long certain types of appointments are, whether they only want to see a certain number of physicals per day, things like that. So the staff are really good at working around whatever works for us so that our practice runs smoothly.
Yeah, so generally the doctors, we each rotate. So every day one doctor is on call. So they'll take things like urgent results that come in, or urgent appointments if the MRP is not available. Yeah, so generally there's a couple of doctors who are working every Saturday, and those 2 doctors will rotate the call. So one doctor will go from Friday to Saturday, and the other doctor will do call on Sunday. The calls over the weekend, they're generally pretty sparse in my experience.
We have both fixed and what we call variable overhead. So we have an amount that everybody contributes to the costs that are always needed to keep the doors open. And then we also do variable overhead, which is supposed to reflect how much you work. So the more you bill, the higher percentage of that you pay. And so it's the most equitable way that this practice has figured out to bill everybody in a way that reflects their use of the office. So it's really variable. So I can't really give you a number, but I would say, as someone who's joined, I thought the thought process they put into it was really great, because once you figured out how it works, it's more fair. Like, it works out really well for everybody. So that's something we can easily share with people who are interested in joining. We can show them an example of our agreement. Everybody here really emphasizes providing good quality care, and I think things like our call schedule and providing Saturday care really reflects that. We try really hard to keep people out of walk-in clinics and out of the ER unless they really have to. So That's my opinion.
Yeah,
Yeah.
and I think kind of along the same lines is just the support everybody provides each other. There's always somebody here if you need anything, if you need advice, if you're sick, if you need time off. It's such a supportive environment amongst all the doctors and the MOAs. And I feel it's just a very safe, welcoming place.
That's a good thing to say.
Yeah,
Yeah, I agree. As much as I should say, like, just join here, it would be to shop around a little bit. So when I first worked here, I'll actually be honest, I didn't like it. The first time I ever locumed, I thought it was too big and I didn't really understand the place. And then when I came back, I was like, oh, it's actually pretty great. And then I had the reverse experience at other offices. So I do think there is benefit to locuming and trying stuff out and figuring out what actually is important to you on a day-to-day basis. And then the other thing would be to really go into the structure of how places work in terms of their associates and affiliates agreements, things like that. I don't feel like I understood it well enough, and thankfully it worked out for me. This place is great, but look into how they run things. That's really important.
Yeah, I would agree. With the shopping around, I did the exact same thing, and I think I took my advice about shopping around from you initially when I first started practicing 5 years ago, and so I locumed here and I looked in so many other places, and again I came back here because there was a different vibe here than any other place that I worked, so it just made sense here.
Thanks. One of the main reasons I joined, beyond how organized they were, was just the staff. The staff was always great. They worked well with me. We're lucky that we've gotten even more new staff that are awesome. And then also just the vibe between the staff and the doctors. We do multiple social events a year, and everybody hangs out in the lunchroom together when they have time off. And I just think that's really nice to have a place where you can do that stuff.
Yeah, I agree. I think the relationship between the staff and the physicians here is different than any other clinic. Yeah, exactly. There's group events. We have great parties. Everybody is always included, and it's always fun, and I just haven't really had that in any other clinic that I ever looked at.
Yeah.